Okay, now it's the Democrats playing politics after they made the promises and then not keeping them. Dr. Frita is here, triple board certified nephrologist and a medical expert in internal medicine, pediatrics, and obesity medicine. She does a live stream on her YouTube channel every Monday at noon Eastern time on trending medical topics in the headlines and celebrity health. And don't forget the Dr. Frita show, very popular show on YouTube. So look, doctor, welcome. This does have life or death consequences, I believe. And they did make that promise before going on break, before Thanksgiving or during Thanksgiving, and opening that government back up.
They absolutely did. I know a lot of people were frustrated from, the Democrats who agreed to open the government back up, but they did so in good faith, according to the ones who agreed, because we were told that there would be a very serious look at extending these subsidies so that people could, maintain their health care. However, with not even having a vote, it really does look like they weren't actually serious about it. And then in just listening to that clip, the whole pivot to if Democrats are serious about health care, well, with the Affordable Care Act, we know that for years, many of the Republicans and Trump, let's, repeal it and replace it. And after almost 10 years, there's been absolutely nothing comparable to it. But what's happening now is that there will be people who cannot afford their premiums. And if they have life or death, illnesses, disorders, then this really could cost Americans their lives.
Are people coming in? Are they concerned about it, Dr. Frita? Your patient?
Absolutely. I've already had patients who look and they see how their premiums will increase. I've had people whose premiums will triple, and they have to make choices, because that's the whole thing about insurance. Even if you are healthy today, it gives you some insurance that if you need some type of a surgery or procedure, then you'll be able to get it. But now I have patients who are talking about taking that gamble. They say, hey, I'm pretty healthy, so why should I spend $15,000 a year on this increased premium? Maybe I'll just wing it and just pay out of pocket. Well, you say that, but then what if you get a diagnosis of cancer, Lord forbid, or if you have to have an emergency surgery? Well, now you've gone from living a life that perhaps you were, able to maintain, pay your bills, and be pretty financially stable, to being either financially devastated or having a health care concern that you cannot treat. So it's very serious, it's very real, and I find it to be very irresponsible. My whole thing, if it's not broken, then why try to fix it? It just really feels like some type of a personal jab at the American, at the what is oftentimes called Obamacare, and I think that's just kind of
personal jab at Barack Obama. He just doesn't want anything that has Barack Obama's name on it, and they don't, and they know it, so they can't. They're trying to. I believe this is their backdoor way of killing Obamacare. And I think that that's what they're doing right now. Of all the channels, I want to play this. This is from Fox News. And I think Fox News is, at least in this clip, they're showing how serious it is. But let's look at it together, and then you and I can talk.
So, Senator, just so people know, if these premiums go away, you're going to see some of these things. Medical inflation will outpace as we roll through all goods in 2000 to 2024. Medical care will go up 121%, and all goods and services will go up 86%. If subsidies expire, low income people making $22,000 or more will have $0, $66 a month for middle income. If those people make $35,000 and up, it'll be about $218 a month more. Older middle income adults, their rates will go up about 508%. So because of the COVID subsidies, people are used to paying a certain price. And we also know the coverage isn't good. It's been a major letdown. But in the short term, which means in the next 2 weeks, do you sense that there might be some compromise here?
Okay, I don't know if Obamacare has been a major letdown. You can answer that, the coverage, whatever. But I think anything can be improved. But the numbers that he's talking about, look, that's high. That's a high for, I don't care what your income is. That's a lot of dough.
It's a lot of money. And you have some people who will be able to absorb the costs and just complain, but some literally cannot afford it, which is really frustrating, because we're supposed to be the leaders of the free world and we're a high income country. When you look at healthcare, you would think that it's a right and not a privilege. And if you have people who are no longer able to afford these premiums, they can't afford to go to the doctor, a great bit of going to the doctor and to your primary care is preventive care. So you don't need open heart surgery. So you don't need dialysis, right? So you don't end up on respiratory failure. So you don't need a heart transplant. what is happening may end up really biting back, because if Americans cannot afford their preventive health, then what's going to happen is they're going to end up sicker in the hospital, and that might end up costing us more in the long run. At any rate, it feels just very irresponsible not to have the vote, and it feels like they were really disingenuous. The Republicans who said that they would really kind of pay attention and try to vote, it just all feels like a scheme, and unfortunately, the ones who are going to have to pay the American people.
Well, part of what I said earlier in my opening monologue, doctor, is that I don't think that they have their ear to the ground and they're actually paying attention to their constituents and to everyday Americans, because this is really going to hurt not only their physical health, their mental health too, if you're worrying about paying bills, but it's going to hurt their wallets. Do you think that these politicians understand what's happening in waiting rooms and on the phones with people trying to figure out how I can help with these bills? Doctors saying, let me do this. And I know, like, when you get, you get certain prescriptions, doctors are saying, well, maybe I can get a coupon card or something or whatever. Do you think these people understand that? Because they've got the Cadillac healthcare plan.
They have the Cadillac healthcare plan. And no, I don't think so. And, you have folks who can call affordability a hoax. That lets you know right off the bat that they're not reading the room. What I really think might come to reality for people to really understand is that it's not just us versus them when it comes to healthcare. You have a lot of people who are Republicans who have been using these subsidies, who've been using this healthcare. You have people who are supporters.
It's going to hurt his constituents, I think, the most. Sorry to cut you off, but I believe that it's
like three-quarters of the people on the plan are from states that Trump won. And so what he's going to find out is that, one, affordability is not a hoax. And he's also going to find out that people will go along to get along. But when they start seeing loved ones suffer, loved ones with sickness, then maybe some of the reality will set in that the promises made, as far as healthcare, being able to afford eggs, all of the things. When you start talking about people's health, life and death, I think a lot of reality is going to set in and they're going to feel it. Unfortunately, the American people are going to feel it first by having premiums they can't afford. What
do you want the lawmakers to know, Dr. Frita, and what do you want people who are watching to know? Because people are wondering, like, oh my gosh, is it still open enrollment, and isn't it Medicare enrollment? Is it still? I don't know if it's still happening. But
I know for some places there'll be enrollment going through January. Other ones it's closing, before the year ends. And so really folks are going to have to reach out for their individual plans. But just in general, I want, for the people, for Mike Johnson, people who are sitting there and somewhat callously, it feels, just saying, oh yeah, we're not going to extend the subsidies. I want them to know that physicians like me are out here fighting every day for the health of Americans, for the health of the least among us. And already, it's not like health insurance has been cheap. It's not like everyone has equal access. It's not like there's not already some issues with equity, but this is just one more punch in people who are already down. And so I want them to know that by being insensitive to the needs of people and being insensitive to the lack of affordability of healthcare, it's going to affect many people in this country, many people who believe in the current administration. And I think they're going to feel it. Yeah. Yeah.
Dr. Frita, I mean, doctor, you're becoming our, medical, of course, you're very good at what you do, and we love having you here. Anything that I missed, Dr. Frita, on, look, I know it's going to, it's going to affect poor and working class people, obviously, more, and people who are in underserved communities, and perhaps women with women's health. I think it costs women much more for healthcare than it does men. So, it's just not good.
It's not good. It's not good. And nothing is going to replace, people being able to go to their own doctor. But I know that, like, for example, on my channel, Dr. Frita, I definitely give evidence-based information in ways that are easy to understand. I talk about traditional medicine. I also talk about natural, holistic medicine with some evidence behind it. And so I encourage people definitely to go to their doctors when they can, but also to look at reputable sources to try to maintain health in the best way that they can while we try to figure this out.
Dr. Frita, check out Dr. Frita's show. It's just called Dr. Frita. Right here.
Dr. Frita Live. Yeah.
Dr. Frita Live on YouTube. It's a great show. And Dr. Frita, thank you so much. We appreciate you taking the time. We'll see you soon.
Thank you.